Hi, I'm Kimberly, and I'm an instructor at the Elkridge branch of the Howard County Library System. Today, I'll be joined by three women who are leaders of local organizations that specialize in helping families, and mothers in particular, deal with pregnancy loss, stillbirth, and infant loss. We hope that by addressing these issues, we can help bring awareness and break the stigma of silence that so often surrounds these issues of loss. Please note that the content provided in this video presentation is for informational purposes only. It is not intended to be used instead of professional medical opinion or advice. Thanks for watching. Our first presenter is Angela Moxley, Chair of the Maryland chapter of the Star Legacy Foundation. Angela, and thank you for joining us.
Thank you so much for having me.
Now, first of all, I had a question. What exactly is the Star Legacy Foundation? What do you do?
Yeah, so I'll pull up just a couple of slides to share some information with you. Okay, so Star Legacy Foundation is a national 501c3 nonprofit. We have chapters all across the country, and our mission is to reduce pregnancy loss and neonatal death and improve care and support for bereaved families. We divide our mission into what we call the 5 pillars, which is what you see here. And they are research, education, awareness, advocacy, and family support. And a lot of what we do around these 5 pillars comes back to our high stillbirth rates in the US. And I'll talk a little bit more about that in a bit. But we have one of the worst rates of stillbirth in the US among developed nations. And this has remained virtually unchanged over the last 50 years, if you can actually believe that. And that's with stillbirth being defined as the loss of a baby after 21 weeks of gestation. So to put that in perspective, I want to show a graphic that Star Legacy Foundation created to share for Pregnancy and Infant Loss Awareness Month, which takes place every year in October. So this graphic here shows the risk of stillbirth compared to other causes of death that we've probably all heard about for babies and children, including SIDS and things like flu and listeria. And I mentioned these last two because these are risks that doctors will often specifically address with pregnant patients. And yet it is rare for doctors to bring up stillbirth with their pregnant patients, even though it is, as you can see, far more common. So when stillbirth does happen to someone, they're usually completely blindsided by how common it is. And that's because of a social stigma that makes people afraid to talk about loss and grief and things like babies dying. So a lot of what we do, just going back again to those 5 pillars, is around the awareness one. So bringing awareness to this issue through our social media accounts and October Awareness Month, through what we call our champion events, and through something that I'll talk about called the Stillbirth Scorecard. Breaking through the stigma and talking about loss openly can help make sure that families receive better support from that bereaved families receive better support from their family members, friends, and healthcare professionals that they interact with when they do experience a loss. And the other thing that breaking the stigma can do, we believe, is actually help to prevent stillbirth, because it can help birthing people just be more aware of the risks and what they can do to minimize those risks. We also focus quite a bit on research, so that's one of the other pillars, so that we can better understand risk factors and how to minimize them. Pregnancy is actually one of the most understudied areas of medicine, and we are working to change that. So we have launched the Pregnancy Research Project in partnership with the University of Michigan to learn more about healthy pregnancies and what makes a healthy pregnancy, and more about poor pregnancy outcomes and what factors contribute to those. So we're looking to enroll large populations of women in this study, and you're eligible to participate if you are at least 18 years of age and have ever experienced a stillbirth at any point. You're also eligible if you've had a living child within the past 5 years, or if you are currently at least 12 weeks pregnant. So we want both people who've had successful pregnancies and those who have experienced loss to participate in this project. And then every 2 years, we have a stillbirth summit that convenes researchers from around the world to focus on stillbirth prevention and care. So that is something, another thing that we do in the area of research. And then with our education pillar, again, focusing on these same healthcare professionals who might come to our summit. Outside of that, we host continuing education workshops for doctors, nurses, social workers, and other medical professionals. Typically, these would be people that are in hospital settings. And we also offer free bereavement and family support brochures and materials to hospitals and health professionals, as well as directly to bereaved families. And then in the area of family support, we offer online support groups for families who have experienced a perinatal loss, for individuals experiencing a pregnancy after loss, and for individuals preparing for childbirth after loss. We also have support groups specifically for dads and grandparents. All these support groups are held via HIPAA-compliant video conferencing, and they're facilitated by trained mental health professionals, and they're all free. And we've been seeing quite a bit of use of these support groups ever since the pandemic started, and many people are finding that their in-person support groups have been suspended, so they're turning to this. We also have a telephone support line staffed by certified grief counselors who have personal experience with pregnancy and infant loss. And then one of the really cool programs that I think we offer is our peer companion program. This is where we match up bereaved individuals. Typically they're newly bereaved, someone who's just experienced a loss. We match them up with others. We try to do it, someone from their own state or from their own area or town who have previously experienced a loss and who are a little bit farther along in the grief process. So we make that match, and then the peer, the trained peer, helps to guide the newly bereaved person through the grief process. And then for advocacy, which is the last pillar, we work in state legislatures to advocate for things like stillbirth tax credit or a certificate of birth resulting in stillbirth, as well as things like declarations for Pregnancy and Infant Loss Awareness Month. So those are some of the projects that we work on, and you can go to our website, starlegacyfoundation.org, and learn more about any of those or any of the many other things that I wasn't able to cover.
So on that phone number hotline, there's a grief support available. When is that available?
The hotline is it's open around the clock. I think we don't call it a hotline, we call it a support line, but yeah.
I'm sorry. Yeah. So I will go ahead and share that support line number. That support line number is 952-715-7731, extension 1. So you addressed a little bit of this in your slides, but how common is stillbirth?
So that's a really great question, because many people just aren't aware. But anyone who has been through this experience should know that they are absolutely not alone. There are so many thousands of other families out there who have gone through this. In the US, about 23,000 babies are stillborn every year. That goes back to that graphic that I showed that compares it to other things that might get more attention. So it's about 23,000 every year, which is the equivalent of one of every 160 pregnancies. And it's about 70 every single day in the US alone. Almost half of all stillbirths actually occur at or near full term. And stillborn babies often seem to be otherwise healthy. And nearly 2/3 of all cases, in fact, a cause is never found. So in terms of risk factors, there certainly are risk factors to be aware of, but sometimes they just aren't obvious. And very often the loss is completely unexpected. And like I said, it happens actually later in the pregnancy, just maybe even weeks or days away from the due date. So if that is your story, again, I just want to let you know that you're not alone in that. In Maryland, more than 500 babies are stillborn every year. This is one of the highest rates in the United States. And so I'm going to show you some information from our stillbirth scorecard, which Star Legacy Foundation put together. So they've done this for all of the states and territories. You can see up here in the top right corner, we are number 44 in the nation. And in this case, we actually want to have a higher number. The higher the number, the worse the rate. And our stillbirth rate, which you see at the top here, is 7.0 per 1,000 live births. That's quite a bit higher than the national average, which is 5.0 per 1,000 live births. We also have a high disparity ratio. So that means that the stillbirth rate, so that's this 1.8. So the stillbirth rate is nearly twice as high for Black and African-American birthing people as it is for Asian and Pacific Islander birthing people, which is the group with the lowest rate in Maryland. And then over here on the right, with this line graph, you can see that the rate really has not changed that much over the past decade. And in fact, this is from 2017. So going all the way back to 2007, it has not budged. It's gone up a little bit in some years. So there's just quite a bit of work to do here in Maryland. And then we back out to pregnancy loss and infant loss as a whole. The numbers are even higher. And again, talking nationally, and certainly this would be true in Maryland too, but so 1 in 4 women will actually lose a baby during pregnancy, delivery, or infancy. So it's likely that if this hasn't happened to you, it's happened to someone you know, even if you don't know about it. And you might not know about it because people often don't talk about it. So it's a much more common outcome than many people realize. And again, it's one of those hidden facts about pregnancy because it's not something we discuss openly.
Thank you for sharing those numbers. Yeah, it's definitely a thing that you don't know about until you know about, until it's come into your life from either family or yourself experiencing something like that.
And I just want to add one thing that is commonly experienced by so many people who go through this after they have a loss. They find out all the other people in their life who had a loss and they never knew it before. So again, even if you think this issue hasn't touched you or someone you know, it's likely that it has and you just don't know about it.
So what advice would you give a recently bereaved parent of a stillborn baby?
Yeah, so I would say, everyone grieves differently. So grief is going to look different for every person, and you just have to find your own way, and it's going to be messy and hard, and some days you're not going to feel like you're making any progress, and that's okay. That's what grief is, and that's part of what makes it so difficult. The most important thing is just to let yourself grieve and not to try to run away from it or not deal with it or not process it. And to grieve, whatever that looks like, if it means visiting your baby every day, posting photos, talking openly about your baby. If it doesn't mean those things and you're a more private person, it also means, grieve openly or not, just grieve however you need to grieve for however long it takes. For stillbirth in particular, and infant loss, it can certainly take months. And and even years until you feel like you have returned to any sort of normal functioning and to where you are able to be around people with babies, pregnant people. Even if you yourself have living children, you may find that it takes years to be able to go to baby showers or just be in that kind of a space. And that's okay. You know, don't let anyone force a timeline on you. You may encounter people in your life who want to tell you, you know, you should move on by now. You know, it was just a baby. It was just a pregnancy. And, you know, that's just coming from someone who just doesn't understand and who hasn't taken the time to try to understand. At Star Legacy and in the baby loss community, we say a little life, but not a little loss. This is a loss that will change you forever. And the other thing I would say is just to find your tribe, you know, so find the baby loss community because they will be your lifeline. So whether that's people in your area or because that's more difficult during the pandemic, finding people online who have been through this because they will get it in a way that many, if not most people in your life will not be able to, they just won't be capable of understanding. So find those people and connect with them and they can help guide you through.
Excellent advice. Thank you for sharing that. Are there volunteer opportunities locally or ways that our patrons can get involved with Star Legacy Foundation or any of your initiatives?
Yeah, so we do have a statewide chapter here in Maryland. We've been active for about 2 years, and so we're still kind of small and are always looking for more support and to grow our chapter so that we can do more things. So there's a lot of ways that you can help with that. Every fall, we organize an annual fundraiser. We just completed our virtual walk a couple weeks ago. We do outreach to hospitals and medical professionals. We run social media accounts. We are compiling a guide for bereaved families, which will have information on resources, bereavement resources specific to Maryland. We need people to train to become peer companions. And we're always figuring out new ways to conduct community outreach during the pandemic since we can't go to health fairs or community events that we used to go to. And those kinds of things are looking different now. So if you'd like to be more involved, you can just find us on Facebook or Instagram. We're Star Legacy Foundation Maryland chapter and send us a message through there. Or you can email us. It's just Maryland chapter, all one word, no hyphen, at starlegacyfoundation.org. And we'd love to have you.
Thank you so much for being with us today and sharing and for all that you are doing in our community. It's really important and I appreciate taking the time to share this with us today. Is there anything else that you'd like to share with us?
Oh, I don't think so, but I appreciate you, taking the time to have a program on this. I think, there's so many people out there in the community that we can reach. So I really appreciate that you have recognized what an important issue that this is.
Definitely. And to learn more about Star Legacy Foundation Maryland chapter, you can visit their website, www.starlegacyfoundation.org/Maryland-chapter.
One additional resource that Angela wanted to highlight is the Star Legacy Foundation's Safer Pregnancy page. It is located at starlegacyfoundation.org/safer-pregnancy. It features steps people can take to reduce the risks of stillbirth. Since risk factors aren't always obvious, these steps are important for people to follow even if they think they're not at risk. This web resource advises things like sleeping on the side and monitoring fetal movement in the 3rd trimester.
Our next presenter is LaToya Bates, who is the director for the Center of Infant and Child Loss, Department of Pediatrics from the University of Maryland School of Medicine. Thank you for joining us, LaToya.
Thank you so much for having me this morning.
So first of all, what is the Center for Infant and Child Loss? So what do you do?
Well, the Center for Infant and Child Loss has been around for 45 years. It was started in 1974 from a federal grant, to study sudden and unexpected death in infancy. And it was written by Dr. Gutberlet and at the time, chief medical examiner. And the initial purpose was to study sudden and unexpected infant death. But what Dr. Gutberlet did with this program that was really instrumental is that he incorporated a bereavement component to this program to help families who'd had that unexpected loss be able to give them a coping mechanisms and supports through a social worker. And then over the years, the grant has grown not just to focus on infant death, but also sudden and unexpected child death up through the age of 16. And so that's the category of families that we deal with who've had a sudden and unexpected loss from birth through the age of 16. And it's all sudden and unexpected. So it's infant death, SUDI, sudden and unexpected death in infancy, accidental asphyxiations in infants, homicides and suicides and car accidents. So we deal with a number of deaths, but I know today our focus is, because this is October and it's SIDS Awareness Month or Infant Loss Awareness Month, we're going to be focusing on the infancy piece.
Thank you. That is such a great program, and I had no idea it had been around for so long. Mm-hmm. How many families generally receive your services?
So on a year, we reach out to about 220 families a year who've dealt with a sudden and unexpected loss. Of those, we deal with about 60 of those deaths are probably infants. And so we kind of, study the trends in death. We reach out to the families to let them know that we are there to support them. And not only that are we here to support them, but we have a network of families who support them as well. But because we service the entire state of Maryland, we also send them packets of information to let them know that there are services wherever they may live. So we'll send them, included with our grief packet, some information to kind of let them know, according to county, where you can seek additional services. And this is the SIDS guide that was written by a mother who had a loss 29 years ago. She wrote this infant survival guide. This is the guide that we make available to every mother who has lost an infant. It's information that we get from the medical examiner's office. And she also supports she's the facilitator of our support group. We have a support group for infants, and we have a support group for child loss, one a month. And these days in COVID times, they are Zoom, and anyone can join. There's no cost to our services. If you want to be a part of the support group, you just reach out to us on our website, which I provided to you, or you could on the flyer, you can reach out to Joni directly, who supports the infant loss, who facilitates the infant loss support group, and Tanya, who supports the child loss support group. And I am also part of those support groups as well. So we co-facilitate the group. So we have that kind of service available to families. So we send them information that lets them know wherever you live in the county, there are support services for you, wherever you live in the state. But in addition, wherever you live in the state, you can participate via Zoom with our support groups. And so we have those services available. And also families have also asked to be connected with another mother. And we have mothers available anytime to connect with families who experienced a loss.
So I see that these Zoom classes are also for mothers or families that have experienced loss through miscarriage or stillbirth. They are welcome at those support groups as well.
Absolutely. Mm-hmm. It's an interesting dynamic because all of the mothers have very similar stories, no matter what stage their loss experience, whether it was stillbirth, whether it was miscarriage, whether it was infant loss. They all have the same emotions, the same feelings, the same need for the validation of their child. So it really is an important group, and no mother is left feeling, all mothers feel inclusive in the groups. Mm-hmm.
So what are some other resources that the CICL has for helping bereaved parents who are struggling with their loss?
So we have quite a few. We have, and a lot of our resources came from families who've had a loss, who then wanted to do something special for families who've experienced a loss, because they really understand the trauma of that sudden and unexpected loss. So we have a few things. One is our Empty Arms Bears. And that program has been around for a number of years. And what we do is we send those bears to emergency rooms across the state. And when a child dies in an emergency room, emergency room staff then provides that child with one of our bears, along with information about the center. More often than not, again, we get information on sudden and unexpected deaths from the medical examiner's office, but those are children who are autopsied. Oftentimes, children are not autopsies, and if they're not autopsied, we don't get that information. And so we try to use different mechanisms to catch families that we otherwise would not catch. And our Empty Arms project is one of those. Another project that came out of loss from a family is our Breland's Blanket Brigade. And Breland was a baby who died. And when she died, her mother was presented Breland in a beautifully handmade blanket. And it was so important for her during that struggle that she wanted to do something similar. And so she started Breland's Blanket Brigade. And what she's done is, and reached out to all of her close friends and family, and they make handmade infant blankets of all different sizes. So we have small little blankets up to really big blankets, you know, depending on the age that your child has died. So there's one if you've had a miscarriage and it's a tiny baby, and if it's 7 months, if it's 8 months. So we have all size blankets that we send out to hospitals, and we also include them in our grief packets as well. Because what mothers said when they receive them, it's just something that they can have, that they can hold on to in honor of a child that they lost.
Can you show us one of the blankets?
Absolutely. So this is one right here, and it's beautiful. And they're all different colors, they're different shapes, they're different sizes. And this is just one. I have so many here, and this is one. And she has some of the blankets that will have a little bonnet attached to it. So there's quite a few blankets that we do display. So we have, that's another one of our significant bereavement supports. And she too is one of those mothers who's available to speak out. And the authors of the books that we have, they're also, again, one is a facilitator of our support group, Tanya, who also had a child loss. And both of the mothers who are facilitators, not only are they social workers, but they're authors. So we send out these books to families at no cost. And it just really talks about the struggles of having a loss. Tanya's daughter was older than one. And it was an accident. And so this book we send out to families who have lost child through an accident. Joni's book we send out to every mother who's had an infant loss. And here's another mother who's also had a loss. And all of these are local mothers, but they've expressed through grief. Talea lost her son through a sudden cardiac issue. And she wasn't aware that her son had this cardiac issue. And he actually died in his sleep. And her favorite memory of her son is the night before he went to bed, she was sure to tell him that she loved him. And so as sad as it was that she lost her son, she was so happy that her last words to her son were, "I love you," right before he went to bed. So we have all these mothers who have written these books that we send out and we share to other families. And I remember a mother who lost her teen son, and I made sure she got this book. She called me and said she read the book in a day. And because every emotion from this page she was feeling. And so that's why we feel like it's really important to share these materials so that families don't feel isolated. Often people who've suffered the death of their child, they're the only person who know that whose child has died. And so it feels so isolating and alone. And so when they get our grief packet, it really helps them feel a little less alone and know that they have places where they can go to get support.
Sounds like you've built a family.
It really is a family, because not only do we have families who support us through writing books and sharing materials and creating bereavement supports for families, we have families who've created fundraisers for us. And our fundraisers have helped us maintain, because we have had funding struggles in the last year or so that has put a damper on a lot of the services that we provide. But the one service that remains consistent is our grief packets to families. We make sure that our grief packets go out. We have our blankets. We make sure that our blankets go out. And we're struggling with funding to kind of keep our doors open, but we're working very hard to do that.
Are there any ways that our patrons can get involved now? Is there?
Well, we have a website.
Yes, the website, and I'll share that right now. That website is www.infantandchildloss.org, and I see you have information there about counseling and support, infant safety and protection measures, and how to volunteer. I also see over here on the side some information about events. Can you tell us some more?
And also, when we open up our events to join our events, our annual walk, this would have been our 20th year for our walk. We have over 400 families that come out, and it's at Quiet Waters Park in Annapolis. It's a beautiful scenery. And we have a dove release where prior to the dove release, folks walk in teams. So a member of each team will come up and say the name of the child that they're walking in memory of. Then we'll release the doves, and then we proceed with our walk. And so anyone who's experienced a loss or anyone who wants to come out and walk, will, because we place flyers everywhere. And so some people who just love to run and walk, they will come and just support the program. So you can either walk in memory of someone, or you can walk because you want to support us. And it's usually in May. And so we're hoping that by the time next year, things will settle down a little bit with COVID so that we can have a walk.
So one of the other things, sorry for interrupting before, was
our Vegas event is held usually in April. And then right after that, we have our walk in May. And then our golf tournament is always the first Monday in October. So next year, we're hoping to have our walk again in May. Probably not our Vegas event. We have lots of senior citizens that come to our Vegas event. So we may want to still postpone that and potentially do it in the fall if we do it next year, because it'll probably still be too early to try to get folks to come out. And we want to make sure our supporters are safe. So we're still on the edge with exactly how we're going to host our Vegas event, which is a huge, fun night, and it's adult only. And what they do is the cost to attend is about $125. And with that cost, you come in, you get $100,000 in chips to gamble with. And then depending on how much you win, you turn in all your chips for raffle tickets. And then we have 3 prizes that we raffle off. So even if you're not the best player and you come in and play a couple of things, you can still put your raffle tickets in the end of the evening for a chance to win one of our grand prizes. So, and it's always a fun event.
So was there anything else that you wanted to share with our patrons about the Center for Infant and Child Loss?
Well, I think one of the biggest things is, again, so we support families who are dealing with this sudden and unexpected death of a child. They put their child to bed and they expect their child to wake up in the morning, and they don't. They send their child off to school and the child is hit by a car. We have children who have emotional issues and take their own lives. We have children who are victims of homicide at various ages. And there's been, drive-by shootings, or they're, caught in the crossfires, or, so various ways in which children die unexpectedly, and families are left empty and trying to determine exactly how they're going to deal with that grief. And so a lot of our materials are really there to help families understand, even families who, maybe have some supports with their church or their community, but it's still not enough to help them deal with this particular loss, because it's so unexpected and it's so isolating. And we just want you to know that there are people out here who want to be available to you, that there are books and supports that we can send you. We have families who, again, if they don't get any information from a hospital, or if they don't get any information from if we don't reach out to them through the medical examiner's office, but if they look up our website and they find us on Facebook, or if they find us on just by sending us an email, we'll send out this grief packet to anybody. And even, you know, our age group is from birth through the age of 16, but I've had mothers who've had a loss at 19 or 20. We'll send a grief packet. So there's nobody that we won't send a grief packet to, especially if you reach out to us. So don't hesitate to reach out to us. We've had friends, again, the doctor who I was telling you about, who want to help a family member. And they'll reach out to us on the family's behalf, and we will respond. So we just want families to know that there are ways to get through and work through the process of grief, because grief isn't something that starts and stops. It is a trail that never ends. And we just want to help you on that journey of validating your grief, helping you cope through, and giving you some tools to kind of deal with yourself, with your family, with your children, surviving children who are dealing with the loss of a sibling. So we just want to make sure, we want to validate, one, that your feelings are real, no matter what the feelings are. We've had families who, you know, you deal with the guilt, you deal with the questions, you know, you haven't done anything wrong, but it still doesn't make you feel better. You know, you're questioning your spiritual beliefs. And so there's so many things that run through a family's family's minds, and particularly mothers and fathers when they have a loss, that, you know, our organization is there to let you know, yeah, those are actually okay, and they're normal, and they don't make you different. And no, you don't have to, even, you know, even if you're not guilty of anything, even though you feel guilty because your baby's not here. People don't want to smile again. They don't want to laugh again because they feel like they're laughing and their child is dead. And so we kind of help them learn to walk through the grief, to understand that it's okay sometimes to smile, and it's okay sometimes to feel good when you really feel like, I don't want to ever feel good again. But that you find ways to feel good, and you find ways to honor that child that you lost. One of the most significant things I've heard families say is that, you know, with their child no longer here, they still want their child's place on this earth to matter. And so that's one of the things that we help families with, to let them know, absolutely, no question about it, your child's place on this earth mattered. And we make sure we provide the services that help them feel that way.
Well, that is amazing. Thank you so much for the work that you do for the community, and for sharing these resources with us today. If anyone wants to learn more about the Center for Infant Child Loss, that website is www.infantandchildloss.org. Mm-hmm. Thank you, LaToya, for joining us today.
Thank you.
I hope you stay safe.
Thank you, and same to you.
And our last guest today is Amanda Meneses, Perinatal Bereavement Coordinator for Rising Hope Perinatal Hospice and Bereavement Program at Howard County General Hospital. Hi, Amanda.
Hi.
Thank you for joining us today.
Certainly.
So my first question for you is, what situations qualify families or mothers for your services?
So Rising Hope services families of pregnancy and infant loss, primarily through miscarriage, stillbirth, prematurity, or genetic conditions that would lead to an infant's death either in pregnancy or shortly after delivery. Most of our families are 16 weeks or greater and deliver on labor and delivery, but any patient, even an early miscarriage who delivers at home or in the emergency room, can request our services. We also service families who are currently pregnant, but whose baby has been given a diagnosis that is incompatible with a long life through the Perinatal Hospice program. Typically, that would happen early in the pregnancy through an ultrasound or an anatomy screen, where the parents are given this diagnosis, and they're then typically given the option of either terminating the pregnancy, and if they choose that, they can still qualify for our resources and support following the termination, or if they elect to continue the pregnancy, that's when we would offer to them the hospice program. Most of our families live in Howard County or receive their OB care either through Howard County General or Howard County General medical providers, but not being directly tied to Howard County doesn't exclude you from all of our services.
So how prevalent or common are these types of situations?
Well, unfortunately, 1 in 4 women experience a pregnancy loss. And about 1 out of every 160 births result in a stillbirth, which is when the baby passes away in utero after the 20th week of pregnancy. Those are the current statistics for the United States. So while it is most common to have a healthy pregnancy that results in a healthy full-term baby, it is certainly not at all uncommon to experience a loss.
At the Rising Hope Perinatal Hospice and Bereavement Program, what resources and services do you provide?
So for our patients and families who deliver at Howard County General, we have trained staff who help to develop a plan of care that sits well with the family. We help them to create a legacy for their baby by creating mementos like handprints and footprints if we can get them, with tiny hats and blankets, allowing them to spend time with their baby that is in a way that is meaningful to them. We also walk them through the difficult process of helping them decide what they would like for their baby after they leave the hospital, like funeral services and etc. Howard County residents and patients of Howard County General Hospital are also eligible for a free cemetery plot through our children's garden, if they so choose. The entire disposition is not free, but having a plot at least reduces some of the financial burden for the families who would like a private burial for their baby. Then after discharge, I personally follow up with all of the families periodically a few times for about a year following the loss. And anyone who contacts the program for assistance is provided resources and an invitation to our monthly support group, which is run by myself and the women's and children's social worker for the hospital. Patients who elect to be part of the perinatal hospice program will receive all of those services in addition to regular meetings throughout the pregnancy, where we develop ongoing plans of care and partner with various departments like NICU, Pediatric Hospice, depending on the baby's condition and the stage of the pregnancy, so that we can best meet the needs of the family. So that way, when the time of delivery comes, most of the decision-making is done, the paperwork is complete, and the family can just better enjoy their time, their very limited and very precious time with their little one.
So what can friends and family do to support a newly bereaved parent or parents who have recently received a diagnosis of a baby that will be incompatible with life?
The biggest thing that I can think of is simply to love and support them. You know, when families are often grieving and they're all, you know, often very well-meaning, but they can, in their words and in their actions, but sometimes in situations like this, families can overburden a couple with a lot of questions and judgments. And oftentimes in situations like this, even us medical professionals don't have all the answers. So oftentimes the family needs, and the couple needs some space, and they need time to process the news and to make a decision that sits well with them. So long as a couple knows their options, it's important to support them in whatever they choose. And whatever they choose is best for them and their family. And then after the baby passes away, the bonds that they have with the people that love them are going to be such a crucial part of their journey towards healing. You know, grief takes a tremendous amount of energy. Something like taking a shower is hard. So helping them with things like a meal train, running errands for them, helping to run other children around can be very helpful and during that grief journey.
So is there anything else that you'd like to share with our patrons?
I think just all of the services that we offer through Howard County Rising Hope are free or else included in the obstetric services that you're already receiving. So you're not paying anything additional to receive these services. We are here to support you in whatever you choose, but I hope that people know that they have options and that there's support in place during this most difficult time. In the world of perinatal loss, parents will often say, it's the group that I never wanted to be a part of, but I'm so glad that they were here when I needed them. And this is truly a very difficult journey to walk, but you're not walking it alone.
Thank you for sharing that with us. Amanda can be reached at her email address should you need any supports or would like further information about the Rising Hope Perinatal Hospice and Development Program. Her email address is adeane, the numeral 3, at jhmi.edu. Thank you for joining us.
Yeah, thank you.
Thank you all for your participation in this presentation and sharing these resources with our patrons. For more information about local resources, visit www.tinyurl.com/HOCO loss resources. Also, you can find information about pregnancy loss, stillbirth, and infant loss through the Howard County Library's collection. Some of these resources, including DVDs, books, and ebooks, are featured and discussed in a recent blog post. You can learn more by visiting www.tinyurl.com/HCLS pregnancy loss. Thank you for watching. I hope you have found something in today's presentation that was helpful and informative. All of the links that were discussed today can be found in the description below. Stay safe.